What if one day your hand just started shaking for no apparent reason? At first, you might totally ignore it. You probably think, oh, I just had way too much coffee, or maybe I just didn't sleep well last night. But what if that small, unexplained tremor was actually the first visible sign of a condition affecting literally millions of people worldwide? Today, we're uncovering the truth about Parkinson's disease, the warning signs you should never, ever ignore, and the latest treatments that are giving real hope to patients around the world. And hey, stay with us until the end of this explainer, because we're also going to reveal some completely unexpected symptoms that most people have no idea are linked to this condition. And crazy enough, they can show up years before any shaking even begins.
Okay, let's dive right in. Welcome to today's explainer, where we're going to demystify a really complex and honestly often misunderstood neurodegenerative disorder, Parkinson's disease. Whether you're living with it yourself, maybe supporting a loved one, or you're just genuinely curious about how the human brain works, we're going to break it all down together.
So, here's our roadmap for today. Section 1, what is Parkinson's disease? 2, early and surprising symptoms. 3, diagnosing the disease. 4, treatments available today. And finally, Section 5, living with Parkinson's.
Let's start with Section 1. What exactly is Parkinson's disease?
So Parkinson's is a progressive neurological disorder. Progressive basically just means it starts slowly and worsens over time. And to really wrap your head around it, we have to talk about dopamine. Think of dopamine as the oil that helps a really complex machine run smoothly. It's a neurotransmitter, a chemical messenger in your brain. Parkinson's happens when the specific nerve cells or neurons that produce this dopamine slowly begin to break down or die off. When you have less of this essential oil, the machine starts to struggle. That irregular brain activity leads directly to movement problems.
Now, this drop in dopamine leads to clinical symptoms, and the most prominent one is something called bradykinesia. That's a fancy medical term, but it really just means an abnormal slowness of movement. This explains exactly why people with Parkinson's find everyday tasks, things we take for granted, like getting out of a chair, buttoning a shirt, or even just taking a shower, increasingly difficult. It's actually not just a loss of strength, it's that the physical amplitude or size of their movements is literally shrinking over time.
Now, you might be wondering, well, why do these dopamine-producing cells die in the first place? The truth? The exact cause remains a mystery. It's really important to note that developing this condition is absolutely nobody's fault. But scientists have found that people with Parkinson's have these unusual clumps of proteins in their brain cells called Lewy bodies. One protein in particular, alpha-synuclein, forms these clumps that the cells just can't break down. As for risk factors, age is the biggest one. It usually starts around age 50 or older, and men are actually slightly more likely to develop it than women. There are also some minor genetic and environmental links, like exposure to certain pesticides, but there's really no single smoking gun.
Moving on to Section 2, early and surprising symptoms.
I want you to think of Parkinson's disease kind of like an iceberg. Right above the water, you have the visible motor symptoms. This is that classic resting tremor in one hand, maybe a stooped posture, stiff muscles, or a reduction in facial expressions, which neurologists sometimes refer to as a masked face. But below the surface of the water, that's where you find the massive, invisible, non-motor symptoms. We're talking severe fatigue, anxiety, depression, constipation, and even a complete loss of the sense of smell. Many people are totally shocked to learn that these invisible symptoms can actually appear years before any of that shaking even begins.
And this brings us to one of the most fascinating and, frankly, surprising early warning signs, REM sleep behavior disorder. So normally when you enter REM sleep, that's the phase where you dream, your body becomes naturally paralyzed so you don't physically act out your dreams. But some people lose this paralyzation. They actually act out their dreams in bed, which can be super disruptive and even dangerous. Neurologists have noted that this specific sleep disorder can be a huge early indicator, sometimes showing up well before any other physical Parkinson's symptoms.
That brings us to Section 3, diagnosing the disease.
You'd think in modern medicine, we'd just, run a quick lab test, right? But the reality is there is currently no single definitive blood test or brain scan to diagnose Parkinson's disease. A doctor might use brain imaging to rule out other problems, like a stroke, but a scan alone won't prove you have Parkinson's.
So instead, neurologists have to rely on a really detailed clinical exam. Picture how a patient might feel walking into that office, maybe a little anxious, looking for answers. The diagnosis actually starts the very moment they sit in the waiting room. The doctor is quietly observing their posture and their facial expressions. Then they'll check muscle tone, feeling for something called cogwheel rigidity, where the muscle moves in a very stiff, jerky way. They'll have the patient rapidly tap their fingers to check for movement slowness, seeing if the taps get smaller over time.
They might even ask the patient to just draw a spiral on a piece of paper to see if their handwriting becomes tiny and cramped. And finally, they do a pull test by gently tugging the patient backward to see if their balance mechanisms are working. It's this deeply observant physical detective work that requires a truly human connection.
Section 4. Treatments available today. Because the brain barrier naturally blocks straight dopamine from entering, doctors have to be pretty clever. The gold standard treatment is a medication called levodopa combined with carbidopa. This combo travels into the brain and is actually converted into dopamine. Another approach uses dopamine agonists. Think of these as molecular impersonators. They basically trick the brain into thinking it's receiving dopamine. Now, the absolutely crucial point here is that dosing is highly customized. Doctors aren't trying to completely cure the disease with these pills. Their goal is to use the minimum amount of medication necessary to reduce symptoms so the patient can maintain a functional, enjoyable life, all while avoiding side effects like dizziness, sleepiness, or even rare impulse control issues.
But for some patients, after years of taking medication, the pills might cause heavy side effects or just stop working smoothly throughout the day. That is when advanced options come in, like deep brain stimulation, or DBS. Think of this as a pacemaker for the brain. Surgeons carefully implant a tiny device that sends electrical pulses to specific areas of the brain. This helps steady those motor symptoms and really reduces the need for heavy medication. While it doesn't cure the disease, it can massively improve a person's day-to-day quality of life.
And finally, Section 5. Living with Parkinson's.
The most important thing to know is that no one has to navigate this challenging disease alone. It really takes a village, or more accurately, a multidisciplinary care team. A neurologist handles the diagnosis and medication, but you also need a physical therapist for movement and balance. An occupational therapist helps adapt daily tasks. A speech therapist is crucial because Parkinson's can actually soften the voice and make swallowing difficult. Add in a dietitian for nutrition and a psychologist or social worker to support the mental health of both the patient and their family. It's a complete 360-degree web of support. But out of everything we've talked about today, I really want to highlight this powerful quote from our sources. Dr. Paramatan, a practicing neurologist, tells their patients something incredible. They say, "Assume I wrote a prescription for exercise."
Why would a doctor say that? Well, because exercise is the one intervention currently known to actively change the course of the disease. While medications only manage the symptoms, consistent exercise actually combats the progression of the illness. Because Parkinson's is fundamentally a movement disorder, the ultimate non-medical intervention is forcing the body to move. Neurologists highly recommend resistance training, balance work, flexibility stretches, and unilateral exercises, which means focusing on the affected side of the body to keep those neural pathways firing. Honestly, if exercise were a pill, doctors would prescribe it to every single Parkinson's patient.
And this brings us to our final thought. Parkinson's isn't just a tremor, it's a deeply complex condition where early detection and healthy lifestyle choices make a world of difference. If you found this explainer helpful, please hit the like button, subscribe to the channel, and turn on notifications so you never miss our future health and medical videos. Share this with your friends and family because awareness could make a real difference in someone's life. If awareness and action can change the course of a progressive disease, who in your life might benefit from knowing these hidden signs today? Thanks so much for watching, and we'll see you in the next explainer.